Hey everybody! I'm so happy to be on here again and to be talking to y'all. So today I wanted to talk about some of my resources that I've been using during my pregnancy and also to discuss my birth wishes with you guys. I've had a lot of people text me and message me and ask me for some of this information. So I thought, well, why don't I just put it in a video? Because it's much simpler to just talk about it and tell you why I like these resources and some of the things that they have helped me with so far. So as of Friday, we will be 15 weeks pregnant. So just right past the first trimester, thank God. So happy to be out of that. It was rough. So I'm getting a little bit of my energy back, like a little bit, don't get crazy. Starting to feel a little bit more like myself, but still exhausted, as you can tell. I mean, like I just got home from work, these are scrubs, this is what my hair looks like every day. So anyways, this is just it. It's all I can handle. It's all I can pull off. So anyways, okay, so first trimester, I kind of talked to you guys about like my experience with that, how we found out we were pregnant, all of that stuff. So I just wanted to kind of talk, just really quick, I just wanted to bring up the fact that I didn't mean to seem like I was complaining about a lot of stuff. I know there are women out there that are hoping and praying that they get pregnant, or they've had a miscarriage, or they've had a stillborn birth, or just all the terrible things that have happened. So I want to just try and empathize with both sides. And like I said, I didn't mean to sound like I was complaining. I just am really trying to be realistic with you guys and let you know what it's really like, because this is not what I was prepared for. So anyway, so second trimester, some updates, feeling a lot better. Still emotionally just like all over the place, roller coasters like you guys. Oh my gosh. If you follow me on Instagram, you've kind of seen what I've been going through lately, but it's just exhausting. So the most annoying thing about it is I've had these terrible dreams that Tez is like cheating on me and like throwing me out of the house, and just like very vivid, detailed dreams. Whenever I wake up, I'm just like completely upset or frustrated or mad, or just I've woken up crying before. And if any of you know Tez, that's the last thing that would ever happen. But for some reason, your insecurities get the best of you, and I guess when you go to sleep, they just come to the surface, and that's all that your little brain can think about. So it's just been really exhausting and really tiring, but I'm trying to just move past that. Apparently, it happens to a lot of women, so whenever I talk about things and then you guys say, oh my gosh, the same thing happened to me, it just makes me feel not good that you went through it, but good that I'm not crazy that it's not only happening to me. So let's get started. Okay, so one thing that I started with immediately that I was like, okay, we're pregnant today, we have to order this, is the What to Expect When You're Expecting book. So this is what it looks like. There are different versions of it. This is the 5th edition, which is the newest edition. This was written by, I believe, I'm not even going to talk about who she is because I really don't know, but basically this has like a ton of information from medical doctors and obstetricians and gynecologists and people that have birthed before and things like that. So this is all super accurate information. And if you see here, I've tabbed a lot of things, and pink is for me and blue is for Tez. So one of the things that I love about this book is it has specific sections that are daddy specific and that go through as like, for example, whenever I went through my first like really crazy mood swing, in order for him to understand it a little bit better, I let him read that section on that. So the sections for daddies are super short and sweet, and they're gray. So everything else for the mamas is in white, and then the dad's portion or the partner's portion is in gray there. So anyways, so we just kind of did that. They even have, it talks about every single thing. One of the things that I like about it is it goes through by month. So this says like the third month, what to expect, the first month, what to expect at your first appointment, what not to eat, what you can eat, what to avoid, all those crazy things. It even has an index in the back, so if you kind of forgot something, you just want to like quickly go to it, you can just look in the index and go through it that way. It even has a whole section on pregnancy loss, if that happens. Managing complications. It talks about labor and delivery, what to expect. Obviously what to expect is in the title, right? And then the first, like, probably this much or more is just about like how to live your lifestyle. And if you're dealing with like depression, can you take your depression meds? If you're dealing with, I don't know, all these different scenarios. I mean, some of it I skipped past because it didn't apply to me. But anyways, you can see how thick it is. It's pretty thick, but I just really took it with us whenever we went places, and I would just read it and make little marks and tabs and stuff, so you can kind of see the important parts on there. They even have a section on what to do in an emergency section, emergency scenario. Oh my God, where you have to give birth at home, or your partner has to give birth in a car or something crazy. So they have like a whole thing that you can print out and put on your fridge in case that happens. Obviously, hopefully not, but anyways, so that I've pretty much read the whole thing. I reference it back and forth because I have forgotten some stuff, and then I don't want it to get too super close to my due date and then be like, oh my gosh, I forgot everything. That's one of my anxieties, is that I'm just going to forget everything that I've even learned, because I have learned a ton. Being pregnant just like opens your eyes to this whole other world that you didn't know existed until you get pregnant. And then you're like, holy crap, there is so much information that you need to know. And the fact that people just like hunky-dorily go through and just like have babies without doing any sort of research, like if that's you, I'm not judging you at all. And that is, it's just amazing to me. I am just like a super type A. I have to know every single detail about every single thing, and it's exhausting. So anyways, that has been monumental so far. And then since then, I've just kind of been branching out and trying to do different things. So one of the other things that I'm reading right now is called Ina May's Guide to Childbirth. So Ina May is like a super, super famous midwife. She's been a midwife for like 100-something years. And so the first half of this book is all birth stories. And it's just a woman after woman after woman after woman talking about all their birth stories and how it happened and how long they were in labor and what they said helped them and what they said did not help them and things like that. And they're all natural births without epidural, without medication, which is what I want to do. So it's just really empowering and inspiring to read hundreds and hundreds and hundreds of birth stories over and over and over again about like how great it can be and how natural it is. This is a very naturalistic book, and so it helps you just kind of understand that nowadays hospitals have taken birth and made it into a super medical procedure, which is actually not supposed to be. It's supposed to be just a very natural part of life. I mean, back in the day, people just used to pop out babies at home all the time. I mean, animals, which are mammals, still pop out babies all the time with no issue. So anyways, it talks about that, but then it does go into like mentality behind it, things that can happen, like breaking your water. There's tons of information. I'm only like halfway done with it, so I don't know what all it entails exactly, but this has been recommended to me. And she actually has a lot of other books too. There's one called Birthing from Within, which is specifically for women that want to give birth unmedicated. So that may be something else that I read. I don't know if I'm gonna have time because I feel like I'm just overwhelmed already with all this information. This one I have not read yet. It was given to me by a friend. Chicken Soup for the Expectant Mother's Soul. So I will let you guys know how that goes. So those are all my books that I've been reading. And then I have also been looking into hypnobirthing. Hypnobirthing is, if you've never heard of it, it is what it sounds like. So it's kind of like putting yourself in a mindset. It's almost like a yoga sort of mindset where you're kind of like getting in touch with your Zen and you're learning these breathing techniques and words of affirmation and things like that. There's actually like 5 portions of hypnobirthing and hypnotherapy, and like how to basically get yourself in the right mindset for having a natural unmedicated birth, which is what I want to do. So there's tons of resources on hypnobirthing. There's classes that you can take. Corpus is really not resource rich, so I haven't really found a good class or anything yet. We may just have to go to San Antonio and do one. But anyway, so I do want to do a class on that. I do want to do a class on just like birthing in general with my partner, with Tez, to just do some actual face-to-face practice with that. And then I'd also like to do a breastfeeding class as well. So those are the classes that I want to do. And those might be a little bit closer to like end of second trimester, beginning of third, when it gets a little bit closer to time. So once I do those classes, I'll talk to you about them and how much they cost and things like that. So those are the classes. The hypnobirthing, like I said, they have classes, but they also have like online. There's a really short podcast. I think it's 4 episodes, but honestly, it's like really great. I listened to all 4 of those episodes, did some breathing techniques. Some of it I already knew from yoga. So it's just kind of like that whole mindset, like mind over matter sort of situation. You can practice a lot of them like whenever you're in severe pain or whenever you're in an uncomfortable situation, you're freezing cold or super hot. So you can actually practice them when you're pooping, which is like the closest it's gonna get to actually having a baby, because that's what it feels like apparently. We'll see. So yeah, so that's hypnobirthing. And then also one of the best podcasts I found. I mean, some podcasts are too much. Some are like, okay, if this girl does not stop talking about her, like what she had for lunch today, I'm gonna freak out. Some of them, I just can't stand their voice. And if you know me, I just get annoyed very easily. So like her voice, some of them I just can't handle it. So anyway, so I'm very specific about my podcast that I listen to, but I do home health. So I'm able to travel to and from homes. And in the car, I like to read, like to listen to those things instead of listening to music, make the most of my time. Whew, you guys, I'm getting real hot. I don't know if you can see, but I'm like red and sweating. This is another side effect of pregnancy. I'm just always hot. Anyways, okay, so Nicole Rankins, Dr. Nicole Rankins is an OBGYN. She's been practicing for like 15 years or something. I don't know. She's amazing. I've listened to almost every episode in her podcast. Her podcast, well, I'm using my phone right now, so I can't like quote them. But basically, she starts off episode 1 is just like 9 things you need to know about pregnancy. That's just like very basic stuff. She is an OBGYN, like I said, so it's very accurate information. You know that it's true. She's not biased at all. So basically she just like gives you all of your options, but then she doesn't say, this is what I would do. So she says, these are your options for pain management. You can do opioids. You can do nitric gas, which is like the gas that you get nitrous. Sorry, I think I just said that wrong. Nitrous gas, whenever like funny laughing gas, like at the dentist office, you can get that for pain medication. You can get an epidural, obviously. You can do nothing at all. So she talks about all those different things. She talks about sleep. She actually has all these specialists that will come on that are specialists in their specific area. Sleep specialist, yoga specialist, specialists like an ear, nose, and throat doctor. She talks about obesity during pregnancy, all these crazy things that you're like, oh my gosh, I didn't know about that. Oh my gosh, what is that? I've never even heard of that. And they're all very short, like less than an hour. Some of them are 15 minutes, some of them are 30 minutes. So just very good information, and just because she's a doctor, she dumbs it down for you and you can understand it. And she has a really amazing voice, so she's just like super professional and funny, and it's just, it's been amazing. So I think there's like, I don't even want to quote this, maybe 30 or 40 something episodes, and I have listened to all of them, and they have all been really great. She also has guests on there that are just moms, not just moms, but she has guests that are moms that have had babies, and they talk about their birth stories and how it went. People that planned on having non-medicated births, then it turned out to be a C-section, how that happened, and da-da-da-da. So basically, it's just really nice to hear. It's like inspiring and things like that. So Nicole Rankins, her pregnancy podcast is called All About Pregnancy. It's free. It's on Spotify, all the places you can get podcasts. It is amazing. Highly recommend that. Honestly, I think that if I hadn't read any of the books, I think her podcast would have probably gotten me through the majority of my pregnancy. And then lastly, on the resources that I used, she has a birthing class, and it's online. So it is 8 hours of content. Really quick before I forget, I wanted to say, make sure if you're reading pregnancy books that you know who wrote it. Because this happened to me. So I was given a book by a friend. I open it up, I start reading, and I'm like, that's not true. that's not true. That's not true. Like, who wrote this? And I slide to the back, and the author is just like a mom of two. Like, no degree, no nothing. Just like a mom who's given her personal opinion about things. Which is fine and dandy, like give your personal opinion. That's what I'm doing right now, but I'm not saying this is medical advice. And if you write a book and you publish it that way, make it seem that way, women are going to take that information and assume that it's correct as if a doctor had written the book, and that's just not fair. So just make sure that you're looking out for who wrote the book and how credible they are and how credible that source is. Okay, so back to the course. So this is the birth preparation course by Dr. Nicole Rankins. Oh my gosh. It will not focus. Okay, anyways, so it is an 8-hour lecture, not lecture, it's individual little segments, and she has a workbook that you can do along with it. And so basically you just take notes as you want. She recommends to do it with your partner, so like Tez and I do this together, and we go through there. So I'm not gonna go into like every single detail in here, but basically module 1, so there's I think 5 modules. There are 6 modules. There is bonus sections, so you have your own she has her own Facebook community. You can go on there. It's like having a doctor at your fingertips. She responds to email, she responds to Facebook messages. If you have any questions about anything. She has a specific section on people that want to have unmedicated hospital births. She also has YouTube videos on there that you can go and watch to kind of prepare yourself mentally. So module 1, lesson 1 talks about your mindset, who will be in the room with you, what do you want your labor room to look like, what to wear, how you go about doing photographs and videos, special practices, who else is in the room with you. Module 2 is the details of labor. They talk about the stages of labor, pain management options, monitoring your baby, vaginal exams, can you eat or drink, should you get IV fluids, the golden hour time, pushing, what happens if you have a tear, what happens if you have to be induced, what happens if you have to have a C-section, like all these really super, super important things that you should know before you have a baby. So anyways, I'm going through this with Tez, like I said. We only do like 1 or 2 every time we sit down because it's not too detailed to where you're overwhelmed, but it's just enough detail to where it teaches you exactly what you need to know, and you at least have heard of it before. So whenever you're in the hospital and something crazy happens, you're not like, what is that? I've never heard of it before. You can at least say, okay, I've heard of that before. Can you remind me what it is? Okay, so that course is $197. It is well worth it. You actually have lifetime access. So if I have another baby in 6 years or whatever, I can always come back here and refresh myself. So you have lifetime access. It's amazing. So I recommend that. That's probably my number 1 recommendation because it's just so informative and it's accurate information and it's just really, really, really great. Before I go into my birth wishes / birth plan, I wanted to just talk about these prenatal vitamins that one of my friends gave me. They are delicious. They are, they look like these little gummies and they're coated in what I call sugar. I don't really know if it is sugar. I'm assuming not because, right? But anyway, so they're like these little things and these little gummies. You take 2 a day and they taste like gummy bears. They are so good. So anyways, if you're looking for a good, what is this called? Prenatal vitamin, then there you go. Simply Good. All right, so my birth wishes, this is basically what happens is you type up a birth plan or birth wish list and you print it out and you take it with you to the hospital and you give that to them, and whoever's taking care of you, your nurse, your doctor, is supposed to really try and abide by that. When I say really try, they should. If they have respect for you, they should. So I've had a lot of people ask me about this, so I'm going to go over it not super detailed because I could talk about this for like another 2 hours because it is a lot of information. But I will post this if you guys are interested, so just let me know if you want it. I can email it directly to you. Obviously you'll change your name and things like that and obviously make it, more according to what you want. But I want to have an unmedicated birth, and what that means is I don't want any Pitocin, which is hormone to get the contraction started. I don't want an epidural. I don't want pain medication. I don't want my water broken. I want that to happen naturally. So basically, I just want to be able to stay at home for as long as possible, be in pain at home for as long as possible, head to the hospital. They say, oh, you're 7 centimeters dilated. Go into labor for a little bit longer at the hospital and then have birth without any sort of medication. So that is obviously best case scenario. That's why it's called birth wishes and not a birth plan. People do call it a birth plan, but we're supposed to be very specific about the words that we use during pregnancy because no one can plan your birth except for your baby, and they don't tell you what's going to happen before it happens. They just make it happen. So now, like I said, I've got controversial feedback from wanting to have an unmedicated birth. And to be honest with you, it's really, I'm putting this information out there because I think it's really necessary. But one of the reasons, I'm not trying to defend myself because honestly, at the end of the day, it's my body and my decision. But if you watch some documentaries and you read about like the pros and cons of doing an epidural versus a C-section versus all the other options, it's just much safer for your baby. Sometimes there's just side effects that happen if you have certain medications done. So basically, if you have an unmedicated natural birth, you're just reducing 90% of those terrible things that could go wrong. There are still probably 10% of things that could go wrong, right? Of course, nothing's perfect, but it just kind of reduces the risk of that. And honestly, I just want to go through this process naturally because I want to really, be there for it all and soak it in and feel the euphoria afterwards and things like that. So another reason just medically is because I have super low blood pressure already. So my blood pressure is usually like 105/60 or something, maybe not that low, but somewhere really low. On a just daily basis. And so if you have an epidurals actually increase your risk for your blood pressure to drop, and that increases your risk to have a C-section. So I obviously don't want to have a C-section, not that there's anything wrong with that, but I just don't want to. And so if I can do anything to prevent that from happening and preventing my blood pressure from dropping and my baby's blood pressure to drop and heart rate to go away and things like that, obviously I'm going to. So this is my birth plan or birth wishes, on how I want to have my unmedicated birth. So before labor begins, there are different stages to labor. You can learn about all of that if you so wish. One of the really great What to Expect When You're Expecting really talks about all the stages of labor and everything and breaks it down for you. I didn't even know there was so many. Did you know that one of the extra stages of labor is actually the placenta coming out, which is like a whole other like delivery? You think just like the baby and that's it? No, that placenta has to come out afterwards, which is like a whole other thing. So anyways, so before the labor begins, as long as the baby and I are healthy, I would like no time restrictions on the length of my pregnancy. So of course, if I get to 42 weeks, that's whenever the risk of stillbirth goes up. So of course we can induce at that point, but I would like to really let my pregnancy go as long as possible. I would like to labor at home as long as possible. So the recommendation is you should stay at home until your contractions are 5 minutes apart and steadily 5 minutes apart for about an hour or two. Some people wait until 3 minutes, especially if you're a first-time mom, because first-time moms usually stay in labor for longer. So the idea of staying at home for as long as possible is that you're in your own environment. You can do things like take a hot shower, which is a really good way to manage the pain. You can get in your own bed. You're just in your own home, and it's more comfortable for you. So I would like to labor at home as long as possible. I trust that my healthcare provider will seek out my opinion before deviating from my wishes. So hopefully. And I would just like to say that one of my friends sent me her birth wishes. She just had a baby not too long ago. And I really and truly just kind of copied and pasted it and just changed some things. So I don't mind at all sharing this with you guys because pregnant women have to help pregnant women out, right? Okay, please ask before performing any vaginal exams. So I'm not sure if you're aware of this, but doctors just like to stick their finger up there and don't even ask you. They just assume that you know what's going to happen because you're in labor or you're having a baby. Like, no, that's still my vagina. You should still let me know before you stick your finger or anything else down there. Even if you are a woman, I don't care. I prefer to induce labor naturally. So that means do not break my water, and that's actually the next bullet point is I prefer not to have my water broken, no use of Pitocin, and no epidural. So they can actually pop your water bag with like a little hook thing. It's terrible. Don't want that to happen. I'd like it to break on my own. No use of Pitocin. Pitocin is basically just a hormone that helps stimulate contractions to come faster if you're not progressing in labor. And that is just side effects can happen with that. Don't want to get into it, but basically if you have Pitocin, your contractions are much worse and much more painful. So let's avoid that. And no epidural, of course. If any of the above are necessary, please explain the risks to me before beginning any procedures. So basically, like I know that this is not perfect, so if you have to do any of these at all and it's absolutely medically necessary, just let me know before you do it. Simple as that. In the environment and for pain relief, I prefer to have my partner with me at all times. If an IV is necessary, as if it's hospital policy, please keep it clamped as long as I am well hydrated on my own. So a lot of people, one of the reasons I don't want to have an epidural is you have an epidural, you have to get a catheter shoved into your pee hole. You also have to be hooked up to an IV continuously, and you also have to have continuous monitoring. So you basically have like all these lines and leads coming out of you. So if you don't have an epidural and you birth naturally or unmedicated, you can walk around freely, you can do what you want, you can get whatever position you want to because your legs aren't numb. And people that say that, this is a myth, that you can actually have an epidural that's not so strong that you can walk around, that's not true. Okay, so if an IV is necessary, please keep it clamped as long as I'm well hydrated, meaning I can drink water on my own to keep myself hydrated. However, if for whatever reason there has to be an IV in my arm, they do what's called a hep lock, and that basically is just where they have the IV just capped on the end, so the needle's already in there. In case of emergency, they can just uncap it and stick whatever they need to in there. So I'm totally fine with that, but I don't want to have an IV hooked up to me, so I'm walking around carrying this big old pole, things like that. Birthing room necessities. Hopefully I want a squatting bar in there, or also I can just utilize handrails that are on the side of the hospital room. A birthing ball, like those big yoga balls. Dimmed lights. Please ask before turning lights on when entering my room. So a lot of pregnancy, a lot of labor, most of it is just mindset and getting in the right mind frame and your environment being set up and correctly. So people should be really knocking before they come in. They should not be just like turning on the lights. It should be however you want it to be. This is supposed to be a natural experience. This should not feel like you're in a hospital. It should really feel like you're in your own home with a couple of extra strangers in there. I would like to play music, so I have a playlist going. I'm not sure exactly what kind of music I'm going to have yet, but I will post that whenever I decide. I will be doing breathing techniques, hypnotherapy, and massage, a water bath and shower if possible. Ideally, I want to be able to walk around and move as I wish while in labor. That includes squatting, standing, kneeling, etc. All right, so that's how I want my environment and pain relief to go. Stage 2 of labor. I prefer not to have an episiotomy, which is, if you don't know, they take scissors and they just snip your little vagina. There are different tears that can happen while you're having a baby. There are tears 1, 2, 3, and 4. 1 being easy, 2 stitches and you're good to go. When I mean tears, I mean like as baby's coming out, your vagina just rips and you have to get a little stitch there. 4 being all the way from your vagina hole to your butthole. So that happens, it's terrible. A lot of times when people tear, it's because they have an epidural and they're not able to feel what's happening, so they can't control it as they're doing it. So they may just push really hard and then boom, it just rips. A lot of times if you have an episiotomy because the doctor's just being impatient, like most doctors are, I take that back. Not most doctors, I'm sorry. Just from listening to podcasts and things like that and women's stories, it's just makes me just not even like doctors anymore. But basically, if a doctor decides to do an episiotomy before you start pushing, things like that, or they say, oh, the baby can't fit through, they try to, tell you whatever they got to tell you to basically force you into doing what they want you to do, then it can actually make the tear worse. So no episiotomy. Instead, hot compresses, oil, or perineal massage. As long as baby and mom are healthy, I'd like no limit on amount of time of pushing. I will try to push instinctively, but please help guide me as this is my first birth and baby. Encourage me to breathe properly for slower crowning, and please talk me through the ring of fire as to reduce the risk of tears. So the ring of fire is just like what it sounds like. It's just like the worst part of birth, whenever the biggest part of the baby's coming out and your skin is just stretching the most and it just feels like your vagina's on fire pretty much. That is whenever most women tear, because they just get to that point and they're like, oh, get this baby out of me, and they just push really hard and then rip. So if you can kind of stay in that ring of fire for 15 to 30 seconds and let your skin adjust, then chances are you won't tear, or you'll have a very, very minimal tear. So, and then delivery and 3rd stage of labor, I would like delayed cord clamping, which is where they wait 1 to 2 minutes before clamping and cutting the umbilical cord. That is just so that the baby can get all the nutrients that it can possibly get. And research shows that it helps reduce risk of A, B, C, and D, whatever. I would like to delay my baby's bath for as long as possible. Please put my baby on my chest immediately after exiting my vagina. So literally vagina, chest. Skin to skin contact should be the first thing that happens. They should not take your baby to the side, wash it off, wrap it up, and then give it back to you. No, it should be vagina, chest. There's so much research that shows that it just helps the baby adjust to the real world experience and things like that. So like I said, I could really go into much more detail about this, but this is just my birth wish, so let's just keep going. Please do not separate my baby and I until after my baby has successfully breastfed, which is about 30 to 60 minutes. I do plan on breastfeeding. If you're not planning on breastfeeding, that's fine. But also, if I was not breastfeeding, that would probably still state, please do not separate my baby and I until after my baby has successfully fed, period. Breast or not, I don't care. Fed is best, not breast is best. The fact that that's even a saying is just ridiculous. Moms should be able to do whatever they want, whenever they want. It's their body, their baby. Okay, newborn procedures. So had the baby, everything's good to go. If the baby has any problems, I would like my partner to be present with him or her at all times. Routine newborn procedures to be delayed and performed on my chest. So do not take my baby away from me. Do not take my baby out of the room unless something major is happening. Immunize the baby according to normal procedures. We are not anti-vaxxers around here. My baby is to be exclusively breastfed, and I would like to see a lactation consultant as soon as possible because chances are I'm not going to know what the hell I'm doing, so I'm going to need some help on that. Full rooming in, no separation unless my baby or myself are sick. That basically just means keeping us all together in the same room. And then I have a separate section for cesarean so all of that fits on one page. And you take that with you to your, when you're having your baby, and you print out, they suggest like 3 to 5 copies. Give one to your nurse, one to the doctor, one to whoever else wants it, I don't care. And then on the back, this is a separate section in case of emergency and you have to have a C-section. So if I do have to have a C-section, if a C-section is not an emergency, please give my partner and me time alone to think about it. My partner is to be present at all times during the procedure. I would like my baby to be shown to me immediately after birth and placed on my chest if possible. So sometimes it's not possible because sterilization and it's surgery, right? So of course there's like different procedures, but they can always so baby comes out of your vagina and they can always hold it up to you and say, here's your baby, da da da. And then like in 10 or 20 minutes or whatever, then they can give it back to you once the sterilization, everything is taken care of. Ideally, I would like to remain conscious during the entire procedure. I would like to have contact with my baby as soon as possible after the procedure in the delivery room. If my baby is healthy, I would like to be able to hold and nurse my baby immediately. As long as my baby is healthy, I would like my partner to be the baby's, if anything goes wrong, I would like my partner to be the baby's constant source of attention until I am free to bond with him or her. So that means skin to skin contact, things like that. So basically, that's my birth wish. This may change a little bit from now until then. We still have 6 months to go, so I'm still learning about things and still adding things and still but honestly you should keep it short and sweet. This is a little bit detailed. I may go through and take some things out as far as like the environment. I can kind of set up my own environment, so may take that section out. Basically the doctor and the nurse that are taking care of you should really just be aware of what you want, and of course, they're going to ask you questions as you go and things like that, but you should have an advocate. You should have an advocate, whether or not that is your partner or your mom or a best friend or whoever you want to be in the room with you, because you're not going to be able to talk and discuss a lot of things. And as long as your partner or your advocate knows everything that you want, there shouldn't be a whole lot of discussion about things. And if anything goes wrong, of course, and we have to deviate from this plan, I'm totally fine with that. I've had people say, well, you shouldn't do that because you can't plan birth. Okay, well, so here's the thing. You can plan it as much as you possibly want to, and then if it doesn't go according to plan, it doesn't go according to plan. But that's just like saying, oh, well, your planner's going to burn in a fire tomorrow, so don't write out your schedule. Okay, that doesn't make a whole lot of sense. So anyways, this is my birth wishes. I will post this if y'all are interested. Just let me know, and I can send you a copy of it personally if you want. So, yeah, so that is just, like I said, just kind of a, general idea. And then if you have any specific questions about like any of those things that I talked about and you're like, I'm having a baby in 3 weeks and I have no idea what Pitocin is, or I have no idea what, I don't know, delayed cord clamping or whatever. If that's you, just, hey, shoot me a text, send me a message. I don't care. We can talk about it. Like I said, the fact that some people just go through and have babies and never even like think about any of these things blows my mind, but more power to you if that's you. Back in the day, guess what? They used to do the same thing. Just like, all right, gonna have this baby. Nowadays, it's just, there's a lot more involved with it. So this is just me. This is the way that I'm preparing. And I'm actually gonna head right now to the pool, hopefully if it doesn't rain, and continue reading my Iname's Guide to Childbirth because it's super good information. And if you have any resources that you think I would like because of kind of the general gist that I'm going for here, send them my way, please. I will add them to my list and try and, start on those too. So that is all, folks. Thanks so much for listening. I will be doing another video soon on who knows what. All right.